Welcome to Instruction Discussion, our weekly look at the latest topics and trends in education affecting schools here on Long Island and schools around the world. Whether you're a teacher, parent, or student, listen for tips and strategies to help you navigate the educational landscape. There's a bell. It's time to start today's Instruction Discussion on the voice of Nassau Community College, 90.3 WHPC.
Hello, I'm Kevin Boston Hill, and welcome to Instruction Discussion, where each week we will examine a recent trend or development in education and its impact on Long Island. This pandemic has exposed a great deal of racial and social economic disparities, from access to proper tools for remote learning to availability of resources to combat the COVID-19 virus. Among these disparities is how the pandemic has disproportionately affected the mental health of communities of color. And it is not just the adults who are affected. The youth have been hit hard as well. To help us understand the current data and research regarding COVID-19's impact on youth mental health, we welcome Dr. Margarita Alegria, Harvard University mental health researcher and chief of the Disparities Research Unit at the Massachusetts General Hospital and the Mongan Institute. Welcome to Instruction Discussion on 90.3 WHPC.
Thank you for having me, Kevin. This is a very important topic, and I'm very glad to be here.
Yes, I know it is a very important topic. I know it's one that is an issue that is kind of near to me because for a long time, I was a K-12 administrator. So seeing the effect that even before the pandemic, seeing the effect that mental health has had on our youth was something that we needed to really start to address within the educational community. And so I think information like this, and especially now, is a good time to get this information out. But before we actually do delve into today's class, so to speak, let's find out a little bit more about you. So where did you begin your career and how did you get to the rank that you have currently?
So I began my career actually in Puerto Rico. I'm originally from Puerto Rico, and I actually went all the way to college. I went to college at Georgetown University, but then actually moved back to Puerto Rico. And I spent doing a lot of work on mental health and poverty in Puerto Rico. So poverty and the impact it has in terms of mental health has been a long passion of mine for a long, long time. I became enamored with this, got a PhD at Temple University, and actually went back, worked in Puerto Rico for a long time doing research work, directed a center, and then got recruited back to Harvard Medical School and Cambridge Health Alliance, where it's one of the public hospitals in Boston. And I really, I have to say, I did a lot of work on disparities, but after a while got very tired of seeing not a lot of change, not a lot of traction, and decided that I needed to change gears and move more to doing more development of models that could be used, low resource models that could be taken to public hospitals, could be taken to other areas that would really make it accessible, feasible, and easy for people to receive mental health services. And I'm very interested, as you can see from my title, in ethnic racial minorities. So we've done a lot of work identifying where the gaps are. We've done a lot of work trying to test new models. We're currently testing 2 new models, and actually one with youth too, a third one. And so our work is really how do we change policy, programs, and practice to reduce ethnic, racial, and linguistic disparities. And now we're actually doing some work in rural populations too.
So let's talk about that a little bit. What are some of those disparities that actually do exist regarding people of color and social economic status and access to mental health treatment programs?
So let me start by saying we have done a lot of work in this country to improve healthcare delivery. Unfortunately, an area that has not improved is disparities. This is a wicked problem. It's been entrenched and embedded in the fabric of the systems, and we don't seem to really move it very well. If you look at the Agency for Healthcare Quality report, you can see that disparities for Blacks, Latinos, Native, Indigenous tribes has not improved. It's really static. And this is a tragedy because we not only do not have better access, but actually not great quality. And even in places as fantastic as New York and Massachusetts, we still have huge disparities between Black, Latinos, people of color, and whites. To give you an example of this, the difference is around 10% less services, which it turns out to be quite a dramatic difference. For example, if I tell you for youth, the difference is, again, very, very large. If a child 12 to 17 has a major depressive episode, 50% of white kids will get services. 36 to 37% of Latino kids will get services. And 35 to 36% of Blacks would get services. So you can see there this 10 to 12% difference. And also where people get care sometimes is different. We're finding for many youth of color that they either have to go to the emergency departments because there's not a lot of options, or they have to actually receive services through their schools. And schools have been terribly, terribly underfunded with regards to mental health care.
I was gonna ask you because we know that when it comes to healthcare generally, that the health insurance is not always the best when it comes to certain communities, especially communities of color and lower income families. So how would they go about getting these mental health services? Many of the providers don't even accept the insurance that they have. So how would they then get those services?
Yeah, this is where we really have to claim better resources for this community. So let me give you the example. We know, because there have been studies about this, that if we increase the payments of Medicaid, if we increase how much we paid for Medicaid, we will reduce the disparities, at least in access, by 2/3.
Wow.
So one of the issues we need to do is really have higher reimbursement. But there's also, I have to say, there's the issue, like you were saying, where do we go? And this is still a problem because we've underfunded behavioral health care. We do not pay for example, substance abuse treatment as we should. The payment is quite low. And therefore, providers don't want to take these payments, and we are at risk of not servicing a population that is in need of the services. So I think what we can do is, one, go to our politicians and really advocate for this new programs that are supposed to be coming in. The Biden administration has said that they're going to move a lot of services of mental health, both to communities and to block grants, to make sure that these communities of color get it. I also think, one thing that has been very, very successful are community clinics. Community clinics have been vastly used by our communities of color. So we should make sure that this federally qualified community clinics keep operating and actually reinforce the needed services they have, because this is our best option right now.
So we started talking a lot about the solutions and the things and the road that we need to go and to help to make things change and make things better. So let's take a quick step back a little bit and find. So what are what's the latest research currently on COVID-19's impact on the youth mental health?
Well, actually, the latest is the really huge impact it's having on youth. We know that around 40% of youth are getting hit hard by elevated symptoms of depression, anxiety, or actually misuse of alcohol. We know that there's, binge drinking, and even the rates of suicide. We're worried to try to see what's going to happen with that.
Okay, wait. I'm sorry to interrupt, but are you telling me that people age, I say 11 to 16, 17 are binge drinking now?
We are seeing that. We are seeing binge drinking. We are seeing problems with regards. The rates, if you look at substance use, has escalated dramatically, and that's more serious drugs. But we see it. We're seeing quite a lot of binge drinking in young adolescents, and we're very worried about the ways people are trying to cope with everything, the economic hardship that they're seeing in their families, the cumulative adversity, because it's like a domino effect. People lose jobs, they have more family conflict because they're stressed out. There's issues about food insecurity. There's eviction from their household. It really becomes a perfect storm, and it becomes, a whole slew of problems that youth are seeing, in addition to all the death that they're seeing in their environment. If you add that, the racial tensions and political violence that we're seeing, it's a very, very uncertain time for youth, and for what this means to their lives and their future. So this is where we have to invest. We can't miss this opportunity with youth today.
So basically what we're talking about here is our youth, our most vulnerable portion of our population, is really dealing with adult problems. And we know that adults have problems dealing with those issues. So how can we truly expect our youngest members of our societies to deal with those same issues that they're clearly not equipped to handle?
And this is where, teachers, this is where youth, people from sports, everyone is going to have to jump into this wagon to try to make sure that these kids do well. Kids do well. I want to emphasize the resiliency and the amazing capacity youth have, especially youth of color, to deal with adversity. I really hope that we go with an asset view of how much these kids can do and how much that they really accommodate to. But I think the tolerance and the erosion of having one after the other, it's really taking a toll. And this is where I'm very worried, particularly for emerging adults. This group not only has shown in data around 58% coming high in symptoms of anxiety, depression, PTSD, but also this is the group that has nowhere to go. There's almost no resources for mental health in community colleges. There's almost no help in, when kids might decide to work for a while. Employers, rarely have mental health services available for them. And this is where we need to try to look at employer-based insurance that covers them, and also look at community colleges and high schools to help us with this, servicing them. And then parents, I think parents have to lower expectations. This is the time to have lower expectations and let kids have fun and reintegrate successfully to school.
You are listening to Instruction Discussion on the voice of Nassau Community College, 90.3 WHPC. My name is Kevin Boston Hill, and our guest today is Dr. Margarita Alegria, Harvard University mental health researcher and chief of the Disparities Research Unit at the Massachusetts General Hospital and the Mongan Institute. You just touched on something that I think I want to kind of explore a little bit more as far as what parents should be looking for, what parents and caregivers can do You mentioned that they need to pay more attention to their students and their children. So what else can parents, teachers, caregivers, any other providers, what steps can they take to help our students of color, Black and Latino students of color, in these difficult times? And how can they, how can they help them to overcome anxiety and the depression that they may be feeling?
So I would say the first thing is talk to them. Talk about COVID. Talk about how it's impacting you, but how more importantly, it's impacting them. Try to hear. Don't try to tell them it doesn't matter. It's true that you have to give hope and you have to tell them that definitely we're going to go over this. But I think it's more importantly to hear what they have to say. How is it impacting their lives? Where do they see the gaps? Is it, they don't see their boyfriend enough? Is it, they're not able to feel connected to their teachers? Where is the gap coming from? And then I think it's quite important to make sure that you are a source of support. We know that family functioning, it's an incredible buffer for child functioning. So the more parents can do, the problem is parents today are pretty stressed out, and you're asking, people to even give more. So I think that this is where peers can do and youth themselves can do. I recently was in a program with a youth from Gonzales, which is a place in Indiana, where they themselves, actually, the youth themselves sign a petition for the school to bring a school counselor because they were so impacted and they didn't want their parents, because exactly what we're talking here, they felt their parents were themselves traumatized and really trying to cope with a lot of grief. So the kids said, we need more resources, and got together, signed petitions, did a lot of advocacy, and were able to get the social worker in their school. So I think youth themselves are going to have to elevate their voice to make sure that we value them more than we have done before.
I think that's a really good example of how, like you said, the youth are just very resilient, and they're stronger than we give them credit for sometimes. And we need to be able to recognize that and kind of nurture that so that they're going to pretty much be able to pull themselves out of this with our help, of course, but they'll be able to pull themselves out of the conundrum that they happen to be in, because there are a lot of adults who are going through the same things. And if the adults can't help themselves, how are they going to help the children? So there's actually a good program, a good strategy that those children came up with.
Yeah, I also want to be careful because we can't, put it all on the youth. I mean, I really think this is where the government, teachers, where neighbors, we need to do more. And this is where we cannot be complicit to everything that's happening and stay quiet, but actually act and try to galvanize the communities, especially our communities of color, to take action in getting resources. We can get now with this community money that's coming from the federal government, we could really put money into, for example, sports, where we get sports together with mental health, substance abuse, counseling. So for kids and then try to bring kids that have been disengaged, either from school or disengaged from their peers, to bring them in and try to help them. This is where we can act rather than react and make sure that we can get youth very early on. We're waiting for kids to come to pediatricians or waiting for kids to come to behavioral health. And that's just not going to happen. It's just not going to happen. Kids are very concerned about confidentiality, as they should at this age. And one last thing I wanted to say is changing the narrative. We need to change the narrative of youth, especially youth of color. This idea that youth of color are, difficult, rebellious, it's the wrong framing. These youth are so amazing. As I was telling you about this case in particular, these youth are amazing. We've been working in Boston with community community youth organizations. And what we're finding is when we empower youth, we give them enough resources, we support them as adults, they are amazing. We had this group in Massachusetts that identified gentrification as someone that was having a terrible effect on their selves. And so they did a video for the political and for the school about how gentrification was affecting their life and their parents' life, which was an amazing way to give the message out there. So that's the sort of thing we need to do, but with support, with making sure that we bring more opportunities.
Now, I've noticed over the last few months that, at least in the educational side and the school-based side, that social emotional learning components have been added to the school curriculum a lot more as an effective, at least as a start to help in the treatment of these mental health concerns. Do you think that's enough, or what more should be done by schools, if anything?
I think that's a great start. I think there is the component of the youth and giving them these strategies. I think we need to do a better job in training our teachers, because I think we have to think of the whole child. I think it is hard for teachers, because teachers, I take my hat off to teachers. They're amazing, and they were one of the true heroes of the pandemic. So I really, really admire teachers. But I think we have focused teachers so much on the academic achievement paradigm that we have really, taken away. We have a lot of kids that are left behind, and we need to help them, get through it. But the most important piece is not the achievement piece. To me, it's really the mental health, because the achievement piece, it's important. I'm not disqualifying that. But we need to make sure that kids are happy kids. They're not, disgruntled adolescents because they're so overwhelmed with demands and with expectations that they can't have a good life. I see our young kids, especially kids of color, with so many worries that are adult worries, like you were saying, Kevin, very adult worries.
Talk to us a little bit about there was a study that you were involved with recently, the impact of Medicaid plans on access to and quality of substance use disorder treatment. What were the findings of that? Is it still ongoing, that research study ongoing? And I guess, how does it parallel some of the other or addressing the mental health challenges that we see?
So to me, this has been an eye opener. Let me say that, we've interviewed more than 80 clients, providers, policymakers, insurers. So it's giving us a whole realm of trying to see, why are we not doing better on substance abuse care? And this is a big, big issue, because if you look at the numbers are tragic. We're losing such a big percentage of young people to what people call death of despair, but it's alcohol poisoning, overdose deaths and suicide. So this is where I think we wanted to learn what was happening. Why are the performance indicators so low? And so we've asked a lot of qualitative work. The quantitative work, we're in the process of going out. So I'll talk mostly about the qualitative work. But what we found is several problems. Regulations. Having too many regulations that make it very hard for people. It's not very consumer driven, but actually there's a lot of barriers to people getting substance abuse care, and also getting quality substance abuse care because of a lot of regulations and policies. We've actually seen this by changing the regulations in COVID and taking out some of these requirements. People are better able to accessing buprenorphine, for example. This was a very good example. But I think the other things that we're seeing that people are talking about is that Medicaid is actually one of their only choices. So they really appreciate having Medicaid and they talk about no one else take them but Medicaid providers. But what I think is we're not investing sufficient resources in really providing a whole cascade of treatments that would make people better. So for example, supportive employment and supported housing, that we know that's the type of security that's going to get people on the right track.
Now, we do have foundations like the Bill and Melinda Gates Foundation and the Robert Wood Johnson Foundation that are kind of contributing monies and funds to this effort. Why isn't that enough? And who else do we need to knock on the doors of to get more support?
I'm so glad you made that question. I think, one, it's not enough because we have underinvested or actually cut funds for a very, very long time, Kevin. So we're really trying to move those systems all the way to where they should be. We're talking about a lot of investment, not only investment in resources, but I'm talking about workforce training. I'm talking about data infrastructure systems that could help people quantify who's out there, who's servicing. We need to also do better in terms of, testing the effectiveness of what we're giving. I think one of the things that we heard over and over from clients is it's not only reducing substances or alcohol, it's actually helping you function and recover all the way. So we need to get people earlier. Another big problem that we have in this country is we get people at the end of the spectrum when they have been a long, long time suffering from this illnesses. So one of the things we are trying is to move the needle to more prevention, outreach, where we get people in the community, invite them to enter services, offer them a whole range of services that includes what they need, and it's not force. We have to change the substance abuse treatment paradigm from one that's very punitive to one that's encouraging and hopeful that you can recover.
That's a lot to take in, and I assume that we really do need to. I think you mentioned it earlier that we really do need to get our local and federal governments more involved as far as the funding to loosen up the purse strings somewhat and just to provide the more funding, and not just funding, but to really make it easier for people to access the resources and the services in many different ways. So I do thank you for bringing all that to our attention. And also, we'd like to thank our guest today, Dr. Margarita Alegria, a Harvard University mental health researcher and chief of the Disparities Research Unit at the Massachusetts General Hospital and the Morgan Institute, for coming on our show today.
Thank you so much.
Once again, my name is Kevin Boston Hill, and thank you all for listening to Instruction Discussion right here on the voice of Nassau Community College, 90.3 WHPC.